The second type of sciatica is very common, and I sort of discovered this over a period of time. I've been treating backache for over 40 years. So it's connected to the hip joint. The hip joint, you have the socket and the ball. It's a ball and socket joint. The hip joint moves. It's a very powerful joint, It's a very powerful joint. It takes the weight of the whole body. And, when you play football, you move in all sorts of directions. And so, if you walk with one foot slightly twisted to the right, you can look at your feet and see if your hip joint is in position. Then, you're in the habit of walking like that. So when you walk like that, the hip joint also moves slightly. So because of this movement, there is a slight misalignment of the joint, and you can say it's a subluxation, and because of this, the body doesn't like it. The hip joint should be perfectly aligned, and then if it moves like that, because you've moved your feet or got into the habit of doing that, or put on a lot of weight, so you have to walk like that, and so what happens? All the muscles, they go into a spasm. They go into a spasm, and it becomes more and more painful, and that spasm spreads to the gluteal region, and it presses on the sciatic area here, and you get a sciatica type pain. Now, sometimes if you have the habit of putting one leg on top of the other and sitting, or crossing your legs a lot, and then you're sitting in the chair with your legs apart, and the hip joint is apart for 6-7 hours a day, you also get the problem of the hip joint. So when the hip joint gets eroded, or there's some inflammation, some problem with the hip joint, then the back muscles will automatically go into a spasm. Sometimes you can feel the spasm in on the sides, and it may twist your spine a little bit. So for this type of pain, you have to, this is the hip joint here, this is the hip joint, and above that you have the soft muscles, suspended. So this is the trochanter, and so you massage the top of the joint. It will be very painful if you have hip joint. So massage it like that, deep into the tissues on top of the hip joint here. Massage. Massage inwards as well, where the sciatic nerve comes out. All the spasms have to be treated deep inside. You should spend about 8 to 10 minutes doing that. Of course, as I said, the lower back muscles will be also involved in that. Goes into a spasm. Do the side of the abdomen, and then place your hands just on the other side of these muscles of the spine and pull it inwards like that. Or if it's on the other side, you push it out. So you pull it inside. So the main stress is on these muscles. Sometimes, if you have sciatic from this point, the pain eases immediately, instantly, because it's not connected to the disc bulge or the scratching of the nerve roots here. So this is caused by the spasm of these muscles. As soon as the spasms go, they get better and easier. Do the hamstrings, press it down. If you're using the massager, then of course you look for the trochanter and go above it, go deep into this thing, right down to the crista, the iliac bone. Do all of that. Do a little bit of this, these muscles here. Release the spasms. Do the hamstrings a little bit. Pressing the hamstrings. The main focus is here. You can do the top of the trochanter as well, because all the tendons are attached there, you see. Muscles are here, the tendons are there. Now turn around. When you turn around, see, you have to do this central part. Very important for hip joint problem, because all these will be in spasm. The hip joint is here, right? If I show it on the other side, the hip joint is there, and you do the central part. Imagine you're doing it on this side for sake of filming. We are showing it here. And these lateral muscles as well. It's very important to do the central part. All of this. Imagine the muscles going from here to the hip joint, so you follow that direction. Go down, the hip joint is here. So you're doing the massage all around the hip joint to get the inflammation out. Of course, you have to also make sure that the toes are kept straight when you walk. You walk like this, right? Not like that. Keep your toes in this direction, in the front, so that you get into the habit of walking like that, because the hip joint has to be aligned for this sort of sciatic pain to go. So if you're doing the massage, then you do the top of the hip joint here, all around, and this part, the hip joint itself, the abdominal muscles, the lateral obliques. You do that. So as form of the exercise, what you do is that you lift your leg up, keep it straight, because this is the leg, this is the hip that's involved. Make a O, right? Make a O, draw an O with your toes, 10 times in one direction, 10 times in the other direction. Yes, the most important exercise is to grab the knee and try and touch your chin to that. 1, 2, 3, down. And the other one also you can do in sympathy, but you have to focus on this one. Okay? Again, 1, 2, 3, 4, 5. You do that, and you also do the other exercise. Keep your feet down. Yeah, the other one, bend your knee and lift this pendulum. This is a very good exercise for the hip joint. 1, 2, 3, 4, 5, down, up, 1, 2, 3, 4, 5, down. So you do these exercises and your sciatic, which is pain, which is related to the hip joint problem, will also go. Okay, stay like this.